If you would like to lose weight, control your blood pressure, lower your cholesterol, and prevent many, many, many chronic diseases, you need to get a hold of insulin resistance. And this is what this video is about today. I'm going to teach you everything I teach all my patients. And if you follow what this video will teach you, you probably don't even have to come see me. But I need to give this information because it's so easy, it's so accessible, everybody can do it. It's simple. It may not be easy, but it's simple. And it doesn't even require you changing so much what you eat. It's more how you eat and when you eat, and things that you do around your meal times that will help with insulin resistance. But before we get into the tips, which I have 7 for you, I just want you to really understand that insulin resistance is the underlying cause of so many things: prediabetes, diabetes, high blood pressure, kidney disease, even cancer, sometimes Alzheimer's. Obviously, it's not the only cause of certain diseases, but it is a huge, huge player, if not the major player. So please pay attention. This information here is gold. So I just want to explain first, what is insulin? Insulin is a hormone that comes from your pancreas, and its function is to take away sugar from the blood and stick it into the cells. The cells will use that sugar for fuel. But what happens if you are eating more sugar, and this comes in the form of carbohydrates in general, good and bad? What happens when you are eating so much that the body has to send out these buses? Let's think of insulin as a bus that will pick up sugar from the blood to put it into the cells, take it to the cells so the cells can use it for fuel. What happens when you're eating more fuel than the cells need? What the cells are going to start doing is transforming the excess that they don't need to use. So the skin cell doesn't need more than it needs, right? The muscle cell doesn't need more than it needs. The eye cell doesn't need more than it needs. Everything that is in excess, it'll start transforming that into fat and storing it as fat. When that reaches a certain limit, there's also a limit to which cells will store fat, right? Cells are going to start becoming insulin resistant, meaning the bus will come full of glucose from the blood to the cell, knock on the door and say, hey, open the garage. And the cell's going to be, nope, I cannot take any more of this. I have no space for you anymore. So this blood sugar goes back. Who takes this is the liver. This excess bus full of sugar, the liver will say, okay, if nobody wants it, bring it over here, bring the sugar over here. And the liver will store that sugar, that excess sugar, as fat, having fatty liver. And we have so many people with fatty liver. Well, this disease process takes years and years and years, and then you start having a blood sugar that doesn't go down anymore because you just can't stuff any more sugar in anywhere. So the blood sugar starts creeping up, and this causes high blood pressure. This causes the high insulin causes the high cholesterol. It starts damaging the high sugar in your blood, starts damaging your eyes, your kidneys, peripheral nerves. So you start having neuropathy. So there are so many things that derive from this, and it's so important. Even your skin will get better if you start controlling your insulin. And let's jump into the tips. Okay, very practical this video is. And I try to put these 7 tips in order of importance, but really everything is so important. But the first one is pairing your carbohydrates. Because when you eat a carbohydrate naked, meaning unpaired, just a popcorn, just a cracker, just a bowl of pasta, what happens is there's nothing there in that meal to hold that blood sugar spike. You'll eat it, you'll digest it, it'll go all to your bloodstream, all that carb, which carbs, when broken down, is glucose, right? Sugar. And your blood sugar will spike. Your body is going to have to put out more buses than it would if you didn't spike your blood sugar. Because what the body needs desperately is to lower this blood sugar as soon as possible. High blood sugar is bad news for the body. It is damage to the eyes. It is damage to the kidneys. It is damage to the veins themselves, where the arteries themselves, where the blood is running sugary. It damages that, and that's what's causing the high blood pressure. Anyway, so pair your carbs. From now on, please remember the phrase, I will never eat a naked carbohydrate. I will put clothes on it. What are clothes that you can put on your carbohydrates? Fiber, which comes from plants, all your veggies, right? Fiber. fats from your good fats, olive oil, avocados, nuts, seeds, and their respective butters, and protein. So these three things are going to help stabilize blood sugar when when they are eaten in the same instance, in the same meal, in the same snack as that carbohydrate. So from now on, please learn that you do not snack on just popcorn. How do you put clothes on popcorn? You can drizzle olive oil. You can eat a piece of jerky with it. You can eat a boiled egg with it. You can eat a few bites of cucumbers, bell peppers, tomatoes, carrots to get some fiber in your belly first, okay? Put clothes on those carbohydrates for the love. That is the most important thing. All right, next step, move 10 minutes after your meals, okay? So a snack, when you eat a little load, and we'll talk about load a little bit later, that's not so significant, but if you can move every time you eat, that would be ideal. Why? Remember I told you insulin is the bus that will take, the only thing that will lower your blood sugar is insulin. It's the only vehicle that blood sugar will jump into and that will take that out to the cells for fuel. However, the muscles are the only cell in your body, the only kind of cell in your body that will pull glucose from the bloodstream without the need for insulin. So when you move your body, and it can be walking, jumping, whatever, dancing, air squatting, contracting your arms. It could be doing calf raises. I teach this a lot for people that are busy and they're on front of their computer and they really can't do anything after lunch. They just have to rush back to the computer or go to a meeting or something. You can just be doing your little calf raises under the desk. Nobody's going to see because you're seated and you're doing, you're going like that. Nobody's going to see. You move, but you're contracting muscles and you're pulling glucose out of the blood without the need for so much insulin. High insulin, high inflammation, high cholesterol. So high insulin drives many, many things that are undesirable. We need insulin. It's great. If we didn't have insulin, we would die, but too much of it is a problem. And that's what we're trying to control here with the tips in this video, is not to put out so much insulin, not to spike your blood sugar so much that we need to put out so many buses out there. Okay. Third tip, veggie starter. Always start with the veggies before you eat anything. So have this in your mind. I will eat a plant food before I eat anything else. Meal, snack, whatever it is, first a plant because of the fiber. So you're going to a restaurant, eat the salad first. You're at home, eat your veggies first. It doesn't matter if it's raw, if it's cooked, if it's sauteed, if it's steamed, it doesn't matter. If it's a plant food, if it's a veggie starter, okay? Veggie starters before all your meal, including breakfast. So if you need to put a couple mouthfuls of anything that you have in your fridge that is a plant, it doesn't need, let's think outside the box. Oh, but this doesn't go with breakfast. It doesn't have to go. You just have to have a veggie starter. Okay, so sometimes I literally will put 2 handfuls of lettuce in my mouth, chew it, swallow, and then have my breakfast. Unless I'll plan before and then part of my breakfast is a veggie hash or something like that. Or a smoothie that everything is, if everything is blended together, that's fine, okay? If it's a smoothie or a soup and everything is together, that's okay. So I'll move into, so this is the third tip, and this will be 3A, is the order in which you eat matters. So you have your veggies first, then you want to eat your proteins, and you want to eat your carbohydrates last, okay? So you never start. When you're super hungry, this is usually what we do. We grab the rice, we grab the pasta, we grab the bread. What does the restaurant do? Bring bread first. No, leave the bread for the end. You never start your meal with a carbohydrate. There is a difference in how much your blood sugar will raise. This has been measured. You can put on a continuous glucose monitor and measure it for yourself so that you see that I'm not lying. There is a difference in how much your blood sugar will spike if you eat the carbohydrate first. Because it's just like eating it naked, remember? So veggie starter, eat a veggie first, then you eat your proteins, and lastly you eat your potatoes, your pasta, your rice, whatever, the toast for your breakfast, whatever you're doing for starch in that meal. Got it? Fourth, apple cider vinegar. It doesn't have to be apple cider vinegar. It could be any vinegar, okay? Let's stand corrected. And you can put it in your salad, you can drink it. The acetic acid, which is a component inside the vinegar, will help you absorb this sugar more slowly, because what we're trying to avoid is spikes, right? And so if you're going to have a high carb meal, you don't have to do vinegar before every meal, but if you know you're going to have a lot of pasta that day, or a lasagna, or something that is a lot of potatoes or a lot of rice, and you know that it's going to be a little bit more than you usually do, have a little bit of vinegar in your salad, for example, or take a shot, a tablespoon with a little bit of water. Always dilute vinegar, never do it straight because you're going to mess up your teeth, enamel. Dilute it in a little water and take a shot of it, okay? The fifth tip is fiber. So you can actually combine vinegar with a fiber like psyllium husk, or like flaxseed, or like chia seeds, and make it into a little shot and have it pre-meal if you're going to have a little bit more carbs, because the acetic acid and the fiber will help form a gel so that you absorb the sugar that you're going to eat in your meal slower. Okay, so you can do just fiber, just vinegar, or both combined. And obviously both combined would be more benefit, and it has to be before the meal, so it's in your tummy before the food comes in. Sixth, no food after sunset. Why? Because once the sun goes down, melatonin is supposed to go up, our hormone that will help us sleep. And once that goes up, we start becoming insulin insensitive. We become insulin resistant, meaning that even if you're not insulin resistant in your daily life, you're not pre-diabetic, but at night we become temporarily insulin resistant because the body is smart. It's not supposed to be digesting food. You're not supposed to be eating late at night. So I say sunset because that is how our circadian rhythm is. But if you think it's impossible to eat right now in the winter, sunset is like 5 or 4:30. So at least give yourself until 7 p.m. to eat. And then after that, don't eat anymore, because at least it gives your time for you to kind of move around, 3 hours about for you to go to bed, and you've got time to get rid of all that sugar in your blood. So the later you eat, the more time this sugar is going to linger around in your blood, because your cells are insulin resistant at night, okay? So very important to have early dinners. So this intermittent fasting craze, and I'm not going to go get into this topic right now. If you're doing something like that, do early dinners rather than skipping breakfast. Our bodies were designed to use food, metabolize food, digest food much better during the day hours, the light hours of the day. So breakfast, lunch, and early dinner is so much better than skip breakfast, or skip lunch, and then have a late dinner. Okay? In terms of metabolism, that is so much better for you. Last tip, the load of the carb matters. So we're almost done here with the video. I'm on the last tip, and I never told you not to eat carbs, right? What I am telling you is that the load matters. The amount matters. So you can do all these tips, but if you eat 5 potatoes, there is no vinegar, there is no fiber, there is no veggie starter that's going to prevent your blood sugar from spiking, because you're just eating so much load. So be careful with the load. It is very common in the US for the plates at restaurants to come with so much carbs, so much rice, so much pasta. Eat half of it. You don't have to eat all that. Eat all of your protein, all of your plant foods, all of your veggies, but eat half of the carb. So I like to think that a good portion size of a carb is a fist, is a cup. A cup. More than that, it's too much load. And it's a cup paired with other things, because you learned in the first tip that you don't do carbs naked, right? Okay, so what's the ideal scenario here? So you are pairing your carbohydrates with proteins, fats, and fibers. Before your meal, you're having a little bit of vinegar with a little bit of fiber. Then you have your meal, eating first the veggie, then the protein, then the starch. And then when you're done with your meal, what are you going to do? Move. And you're having early dinners. I think I was able to put it all together for you. And I cannot stress this enough. This information is gold, and it works. And if you do it for a month, I would really, really like you to comment and tell me if you lost weight, if you had more energy, if you stopped breaking out, because insulin drives acne. It also messes up your hormones when you're insulin resistant, because especially people with PCOS, infertility, it'll help so many things in your life.